Hey guys, it's Shadow the Rat, and for today's video, unfortunately, I have some bad news, because Miss Butter here has been diagnosed with a pituitary gland tumor. And if you don't know, pituitary gland tumors are the most common type of brain tumor you can find in rats, and they're most common in older rats over a year and a half of age, especially females. And Butter here is a little over 2. Now, in my opinion, pituitary gland tumors are pretty much the worst thing you can see in older rats, because while there are a variety of awful things that can, occur health-wise, pituitary gland tumors are the thing that kind of take away your rat's, self, so to speak, because they just make them confused and dazed and out of it, and just really completely remove everything that kind of makes the rat themselves, and they're often not even treatable to boot, so they're just really, really awful. Now, there's a few symptoms for pituitary gland tumors, but the most common one is difficulty using their front paws. So the rat will typically struggle to hold things in their front paws. You'll also often notice them struggle to groom with their front paws. They might cross them or kind of hold them stiffly. This sort of weird head movement you see with Butter is also very common. Another thing that you'll see is that oftentimes they'll have difficulty licking things. They'll try to bite liquids. They'll act kind of lethargic in a sort of dazed way. So they'll still try to get around, but they'll be really dazed and confused. It's also common for them to not be able to groom very well, so they might have extra porphyrin. And unfortunately, all of these things kind of culminate in the diagnosis of pituitary gland tumor. And typically, you will diagnose a pituitary gland tumor based on these symptoms alone, because the only way to physically test for it is to do a CT scan. You can also do an MRI. However, MRIs can only detect very large pituitary gland tumors in rats, and oftentimes they are not effective at diagnosing them. And most places don't have the ability to do an MRI or a CT scan on rats anyways, so oftentimes symptoms are pretty much all you have to go on when it comes to diagnosing them. Now, as far as treatments go, not all pituitary gland tumors are treatable. In fact, a lot of them just aren't. But with that being said, there are some options out there. Specifically, you start with a steroid shot, usually a Dex shot, and this is given at a high dose. And what this does is it reduces inflammation around the tumor, because basically the symptoms from the pituitary gland tumors don't actually come from the tumors themselves. They instead come from the tumor causing a buildup of pressure in the skull that compresses the rest of the brain, and as a result, you see all these awful symptoms. And not only do you have to worry about the tumor itself causing pressure buildup, but you also have to worry about the inflammation caused by the body's own immune system around the tumor. So this also causes extra pressure buildup and causes worse symptoms. So by initially giving your rat a Dex shot or just any sort of steroids, that helps to immediately reduce the pressure in the brain, because steroids will reduce inflammation, and then this reduces pressure, which as a result reduces symptoms, at least temporarily. Now, unfortunately, steroids only help temporarily, because as the tumor grows, it will eventually reach the point where it's large enough that even without the additional pressure from inflammation, it's still causing enough pressure on the brain to cause serious symptoms or even death. Steroids alone, unfortunately, are not an end-all solution. And if you're very, very lucky and the tumor is very slow growing, steroids could get you a few weeks of extra quality time, but usually you will not get that much time with steroids alone. So that's where these secondary medications, cabergoline and bromocriptine, come in. These medications are prolactin antagonists. If your rat has one specific type of pituitary gland tumor, prolactinomas, these will actually shrink those types of pituitary gland tumors. And this is unfortunately the only way that you can actually treat pituitary gland tumors in rats, because while the steroids might give you some temporary time, it's only if your rat has a prolactinoma that actually responds to cabergoline or bromocriptine that you actually get a significant amount of time back with them, because these drugs can shrink the tumor for months or even years. So personally, my best response was with my girl Donut. She was on cabergoline for nearly a year for pituitary gland tumor, and she had a perfect quality of life the entire time as long as she was on cabergoline. So if your rat has a tumor that's responsive, it can work super well. But unfortunately, if your rat does not have a tumor that's responsive, you're pretty much out of luck, because we can't do brain surgery on rats, or at least you can't do it in a vet setting. And as a result, if your rat's tumor is not responsive to one of these drugs, you pretty much just have to put them to sleep once the steroids stop having enough effect. So that brings me to Butter, because I'm doing a typical treatment plan for pituitary gland tumors with her. That is to say, the first thing we did was we went to the vet and we got her a Dex shot, and she's now been started on oral prednisone, which is also a steroid. It's not as strong as Dex, but it's still pretty strong, and it can definitely help to keep inflammation down in the brain, which is what it's being used for here. And we're also going to be getting cabergoline for Butter tomorrow. The pharmacy unfortunately didn't have it today, and my vet ordered it yesterday, so we should be getting some tomorrow. And in the meantime, I've started her on some cabergoline that I had left over from my prior rats with pituitary gland tumors. So how is Butter responding? Well, it's been a little over a day since she got her steroid shot, and initially the response was pretty slim. I'd say within 12 hours, I didn't really see much response. After maybe 15, 16 hours, I noticed she was able to hold things with her paws again, which is definitely a good thing. You know, that is progress. But unfortunately, her progress has kind of plateaued there, and I haven't seen much more progress since that. She can still use her front paws pretty well right now, but she doesn't seem to be progressing beyond that. Which is a little disappointing, because if your rat responds well to the steroids, you could get a few weeks just with steroids alone, even if the rat isn't responsive to cabergoline or bromocriptine. But if they're not responding well to the steroids and not responding super strongly, then you kind of just have to put all your bets on cabergoline or bromo and really hope that your rat's tumor is responsive to those. So I'm not super happy with the response I saw with Butter. It's not the worst, but it's also definitely not the best. And it does make me a little bit worried about how she's going to do, even though we're going to start cabergoline soon, because honestly, if your rat doesn't respond within a week and a half of starting cabergoline or bromocriptine, and if they're also not responding very well to steroids, then the best thing to do is to put them to sleep, because these tumors are quite painful, especially as they grow. That brings me to another thing, which is that Butter herself is also on gabapentin for the pain, and also on Tylenol as well. And both those drugs are safe to use with steroids. You can also use a few other things like tramadol as a painkiller, but typically there aren't a lot of options out there when you're using steroids for using painkillers as well, which is unfortunately a downside, because there have been reports, at least in humans, of feeling like headache pain when they have pituitary gland tumors. And with my rats, I've definitely seen as well that they do act like they feel pretty uncomfortable if their pituitary gland tumor either isn't responding well to treatment or if they aren't on treatment yet. Where does that leave us? Well, honestly, I'm going to keep trying treatment with Butter, because I have had good luck in the past, and I figure it's always worth a shot. But right now, I'm not super happy with how she's responded to the initial steroids. Again, it's definitely not the worst response, and she has shown some progress, but I was really hoping to see more, so it's a little disappointing. But yeah, if Butter does not respond to the cabergoline, and if her response to steroids keeps being pretty slim, then I will be having her euthanized in about a week and a half or so. But for now, I am just keeping an eye on her, and hopefully she will start to respond to the cabergoline, because, well, I would really like to get more time with her, and these tumors are just really awful. So I hate so much that there's just such a limited thing you can do for them. I wish, that we could do more for rats with these. Anyways, that's it for this video. I will keep you guys updated. Bye.